We can all agree that it's critical to prevent events like heart attacks and strokes. In the past 3 years, science has proven that the cause of these events, and in some cases the cause of dementia, including Alzheimer's disease, are plaque rupture and inflammation. A rupture of an inflamed artery plaque. So first of all, what is a plaque rupture? Well, as we discussed in the past, a plaque is a volcano in the artery. It's a lump that's developed through the surface of the artery that's vulnerable to rupture. It can be tiny. 86% of plaques that rupture and cause a heart attack won't be detected on a stress test. So it's important to pick them up at an early stage. So what ends up happening is that plaque breaks open. It ruptures just like a volcano does. It erupts. And it spews into the center of your artery. And then what happens is your body kicks in and causes a clot. So that partially blocked artery clots off, completely blocks that artery, and prevents all oxygen from flowing to where it needs to go. If it happens in the brain, it's a stroke. If it happens in the heart, it's a heart attack. So why do plaques rupture? Well, they get inflamed. An inflamed plaque can rupture. A cool plaque, it won't rupture. So what causes a plaque to inflame? Well, inflammation is actually a normal process. We all have it happen. Think of when you get a cut. If you get a cut, what happens? It gets red, it gets swollen. That's the body's defense mechanism to heal that cut. And if it doesn't get infected in a few days, it's all back to normal. That's inflammation. We have inflammation for a reason. It's the body's mechanism to fight off disease and injury. So what ends up happening in our arteries is that inflammation is never turned off. Certain choices that we have, certain conditions that we have will cause an ongoing inflammation and will cause that artery to be inflamed. And an inflamed plaque has a chance of rupturing. So what causes inflammation? Well, there are lots of different causes that we'll talk in another segment, but suffice it to say we can measure inflammation. There are simple blood tests that are scientifically sound that can identify if your arteries are on fire. And if your arteries are on fire, that they have the opportunity to rupture. So we have what's called a fire panel that look to see if you are inflamed. And what do you do if you're inflamed? You don't treat inflammation with a pill. That doesn't work. What you have to do is identify the cause of that inflammation, treat the cause, your arteries cool, and a cool artery is a safe artery. A cool cat is a happy cat, and that cat won't jump out and kill the pigeon and cause a plaque rupture.